and welcome to Physio YouTube channel. My name is Kira Mooney and I'm a chartered physiotherapist with Physio and we've set up this channel for this series to bring you through what our clinical Pilates classes look like that we do in our clinic. This is episode 1, which is bringing you through the basics of Pilates to set you up for joining our classes that will follow this episode in our I think it's a 10-part series or 11-part series. So first and foremost, we just want to let you know that it's really important that if you have back pain that you know that you can exercise. That's the whole idea between us putting this series together. But that said, if you have back or neck pain at any point during these exercises, it's important that you stop and get it checked out. We'll remind you time and time again that you shouldn't feel back or neck pain. If in doubt, you get it checked out by your healthcare professional or your chartered physio. As I said, today is all about the basics. Once I finish this video, you'll be able to take what you've learned and go and on to our next series of videos where we start the 30-minute Pilates classes. In the next sort of 10-15 minutes, you're going to learn all the basics. So, let's get started. As you can see here, my equipment consists of a mat. Probably not bring that back. So, equipment-wise, I have a simple mat, but you could do it on a carpet floor at home, and a Pilates block, which looks like that. It's a little thin block. Now, how much support you have under your neck is going to depend on your neck position. I'll show you that in a second. But a simple folded up hand towel will do the job just as well as a Pilates block. You do not need any fancy equipment to do this. You can do it all at home with absolutely nothing. So, the first move before we start is going to be called a roll up and roll down. One of the big things that we see in clinic when people have back pain is a fear of bending forward. This first move addresses that fear straight away. So to start with, you're going to stand at the end of your mat, 2 feet together, legs nice and straight. You're going to take a breath in for me, and as you breathe out, slowly but surely, you're going to bring each segment of your spine down. Head first, then the shoulders, then the chest, then each segment of the back comes down, down and down, as far as you feel you can. Now remember, we said no back pain. You should feel this in the backs of the legs. If you're feeling any discomfort in your back, just come up slightly. Now let's roll it up. You're going to bring your hips up first, back up, chest up, shoulders up, and head up. 2 more. Take a breath in, and as you breathe out, head down, shoulders down, chest down, reach down, down and down. Pause at the bottom, feel that stretch, let the arms relax. Here we go, we're going to bring it up. Hips up first, back up, chest up, shoulders up, head up. 1 more, roll up and roll down. Here we go, take a breath in, and as you breathe out, head down, shoulders down, chest down, reaching down, down and down. Nice and slowly, we're bending every part of that spine, nice and controlled. We're going to bring it back up. Hips up, back up, chest up, shoulders up, head up, and relax it off. That's your first basic Pilates move, a roll up and roll down. We'll come back to this during every class that we do to get you confident in bending that spine. Next, we're going to bring it down to our mats nice and slowly. So just nice and gently, bring it into 4-point kneeling. If you've got back pain, you can come into side lying to bring it down. If you have no pain, you're just going to come down into what we're going to call our starting position. So you're going to take your folded up towel or little cushion to the end of your mat, and then nice and gently you're going to bring it down onto your back. Now, when we talk about starting position in lying, I'm about to show you what we're talking about. Excuse me. So, from the bottom to the top, your knees are bent, your feet are close to your bum. There's a little gap between your feet, a little gap between your knees. Your shoulders are on the mat, shoulder blades on the mat, and this neck is going to be in what we call neutral. So what does neutral mean? Well, it means that you're looking directly at the ceiling in front of you. You're not rotating that neck left or right. It's right in the center or tilting it to the side. So it's completely in the center. We want to make sure that that chin isn't up towards the ceiling. Now this is what I said about the block. So for me, if I tilt my chin down, give myself a slight double chin, then I'm in that perfect neutral position. At home, if you find your chin is still poking up and that's not comfortable, then you need a bigger support under that head. So maybe a normal pillow will do the job a little bit better to make sure you're in that neutral position with your chin. The shoulders stay nice and relaxed, hands by your side. Now, the first thing we're going to think about here in our starting position is getting the same neutral position in our neck and our lower back. To do this, we're going to start by practicing something called pelvic tilting. So I want you to think about your hip position on the mat. I want you to think about where the mat is and where your back is in relation to that mat. So I'm going to show you first. This is what the pelvic tilting looks like. You're going to rock those hips back, and what you're doing here is flattening that back into the mat. And then you're going to go the complete opposite way, arching that back away, causing a gap between you and the mat. Try it for me. You're going to flatten that back into the mat, rocking those hips back, then arch away, away, away. Keeping those hands by your side. Keep practicing. Flatten that back into the mat. Arch away, away, away. Big gap between you and the mat. Now if you have back pain here, just take it nice and gentle, going as far as you feel that you can. One more for me. Flatten that back into the mat. Now come back halfway. So you're not completely arched, you're not completely flat, you're exactly halfway. And that is your neutral pelvis. That's the position we're going to come back to start all of our exercises. So let's recap that. There's a gap between our feet, our knees are bent up, gap between our knees, pelvis is neutral, our ribs, we're not flaring our ribs up off the mat, those lower ribs are just resting gently on the mat, shoulder blades on the mat, shoulders nice and relaxed, chin is tucked down, and that neck is in neutral. Now we're ready to get our core contraction. So in Pilates, the whole goal is to try and keep us nice and strong, our tummies, our legs. And we start our exercises with this core contraction. And what we're simply talking about here is one of our deep tummy muscles. We're not talking about those six-pack muscles, so we're not looking for a full abdominal contraction here. We're actually talking about the lower part of our tummy muscle. And I'm going to talk you through this contraction now. So in your neutral position, I want you to take 2 fingers on each hand, find that bony part in front of your hip, and slide your fingers close together. I want you to press down firmly so that you can feel this contraction. Now, I want you to think about where your belly button is. And I want you to very gently pull that belly button down towards your spine by tightening that lower part of your tummy. And then relax it off. If you've got it, you should start to feel a faint contraction underneath your fingers. Don't worry if you can't, it can take some time to get this right. You're going to take a gentle contraction in, tightening that tummy muscle, and then relax it off. Now I would have to say that most people when they start Pilates with us have no awareness of that contraction, but within 2 to 3 weeks they know exactly what we're talking about. So please, if you do not feel it on the first time you've done this video, please do not panic. If you follow the instructions, that tummy muscle will get stronger and you'll start to feel exactly what I'm talking about. So now I want you to place your hands back on the mat and we're going to practice getting this contraction. You're going to take a breath in for me. And as you breathe out, you're going to pull that tummy muscle towards the mat underneath you, tightening that belly button. Hold it for 2, 1, and relax it off. Now the biggest mistake we see in class is when I get you to tighten that tummy muscle, you tilt your hips back into the mat. Please be careful here to make sure that you keep that pelvis in that neutral position. Hold it still. So you take a breath in, and as you breathe out, tighten that tummy muscle, keep those hips completely still. Hold it for 2, 1, and relax it off. Now, the other part of our tummy muscle is one part of it. The other part that I want us to think about is our pelvic floor. Our pelvic floor is the muscle that supports us from underneath, and it's a key muscle in keeping our back nice and strong. So when we talk about our tummy muscle, we also talk about our pelvic floor. So to get this contraction, all you simply have to do is imagine that you're trying to stop the flow of your urine. So you're pulling up from down below. We're going to try and combine these contractions now and see what it feels like. So back into that starting position, neck is in neutral, shoulders relaxed. You're going to take a breath in for me. And as you breathe out, you're going to tighten that tummy muscle first. Now I want you to imagine that you're stopping yourself going to the toilet. Pull up from down below. It'll make your tummy muscle contraction even stronger. So now that tummy is moving down slightly, that pelvic floor is moving up, everything's nice and tight, and then you relax it off. But most importantly, nothing is moving from the pelvis. Let's practice 2 more. Breathe in, and as you breathe out, get that tummy contraction, pull up that pelvic floor. Hold it for me for 3, 2, 1, relax it off. Remember what I said, if you can't feel what I'm talking about, don't panic. Just keep following the instructions and day by day you'll start to get stronger. 2 more. Breathe in. And as you breathe out, tummy tight, pull up that pelvic floor. Hold it for 2, 1, and let it go. Last one. Breathe in. And as you breathe out, pull in that tummy, pull up that pelvic floor. Hold it for 2, 1, and relax it off. Brilliant. I want you now nice and slowly to bring yourself back into sitting for me. Into 4-point kneeling, come onto your side. Now we're going to transition. So in Pilates we try and make our movement from one position to the other nice and smooth. You're going to take your right leg, pop that foot on the mat, use your hands to support yourself. Now your 2 feet are together and we're going to practice that roll up again. You're going to straighten your legs, you're going to bring your hips up, back up, chest up, shoulders up, and head up. 1 more roll up to finish it off. Take a breath in, and as you breathe out, head down, shoulders down, chest down, reach down, down and down. Remember, you should feel it in the backs of the legs. If it's in the back, just come up slightly. Roll it up, hips up first, back up, chest up, shoulders up, head up, and relax. There you have it. That is the key moves in our basic Pilates section for today. From here, let's recap. So we taught you your roll up and roll down. Then we went into our normal starting position in lion, teaching you how to get your neutral position in your neck, your pelvic tilting, stopping halfway to get that neutral pelvis, and then probably the most important part of all, that tummy contraction combined with that pelvic floor contraction. Now you're ready to start our clinical Pilates classes. So carry on to our episode 2 where we take you through that level 1 for beginners. Well done, and hopefully you've got those key concepts moving on to our level 1 class.